office, I'd like to explain a little bit more about us. We are Showhead Ear Associates. We're dedicated to helping patients with any type of medical ear condition or hearing loss get the treatment and care that they need. We have 3 locations, which are located conveniently in Newport Beach, Seal Beach, and Irvine. At Showhead Ear Associates, we offer a team approach to patient care. Our ear specialists and audiologists work together to properly diagnose and treat any ear or hearing condition. Additionally, we offer comprehensive care that includes conducting all diagnostic and advanced hearing tests on site, offering a variety of hearing devices based on individual needs, preferences, and lifestyles, as well as a fully equipped surgical center. We're so excited that you're here today wanting to learn more, and we can't wait to get started with today's topic, to Q-tip or not to Q-tip, what you should and shouldn't do to manage earwax. And this is just a friendly reminder that your audio and video will be turned off during this webinar so that everyone can easily hear the speakers. We'd like to encourage everyone to use the chat as well as the question and answer feature at the bottom of your screens at any point during our presentation to submit your questions. We will answer all questions at the end of the presentation. And during our presentation, you'll see a few pop-up questions on your screen. Have fun choosing your answers and remember that your responses are completely anonymous. The poll questions will just help demonstrate some of the points made during our presentation. All right, it looks like several more of you have joined. So we can go ahead and get started in a few minutes here. But first, I would like to introduce our 2 speakers. Today, we will be joined by our main speaker, Nina Harris, who is one of our skilled audiology doctoral externs. And Nina will be joined by one of our esteemed physician assistants, Carolyn Lynn, who will be helping field your questions at the end of this talk, as well as offering her own professional advice on the topic of earwax management, which is a topic that I think affects us all at some point. Without further ado, take it away, Nina.
Hi, everyone. Thank you so much for joining us today. I'm here joined by Carolyn.
Hi.
And our topic for today is why you're all here, to Q-tip or not to Q-tip, what you should and shouldn't do to manage earwax. I'd like to start us off with a poll question, just to get to know a little bit more about all of you. So if you could please select any of these options on your screen. How do you clean your ears at home? Maybe you use Q-tips, maybe you use a wax picker tool you bought at a drugstore. Maybe you use hydrogen peroxide. Maybe you clean your ears with warm soapy water. Maybe you don't clean your ears, or maybe you do something else. I'm seeing a lot of answers rolling in, so thank you so much for participating. We really appreciate it. All right, it looks like about 60% of you use Q-tips. And it looks like some other people use warm soapy water. Some of you don't clean your ears, and a few other of you use other things as well, or maybe you don't do anything. Great. All right, so just to jump right into it, why do our ears make wax? So earwax, or medically what's known as cerumen, is actually a biological defense mechanism, and it's designed to protect our ears. It's both important and very necessary to protect our eardrum and our ear canal from dirt, dust, foreign objects, dryness, other things in the environment. So now what do you think? Do you think most people should clean out their earwax? You can select from the options again. Yes, no, or maybe you're not sure. Again, thank you so much for all participating. We really appreciate it. All right, it looks like about 40% of you said yes, 40% of you said that you're not sure, and about 20% of you said no. Great. So your ear actually is self-cleaning. If you were to envision your ear canal with your eardrum at one end and the entrance at the other, earwax actually forms only in the outer 2/3 of your ear canal. It doesn't form in the inner third closest to the eardrum. Earwax actually naturally migrates out of the ear canal, where the skin cells just grow outward. And that migration is assisted by jaw movement when we talk and when we eat. However, some things can go wrong. The self-cleaning mechanism might not work as well, and the earwax can become what we call impacted, or wax can be produced at a faster rate than the migration rate. So it doesn't move out quick enough to make up for all of the wax that's being formed. So again, I'll ask the question, do most people need to clean out their earwax? This isn't for you to respond to, but no, most people do not need to clean out their earwax. Certain people may need routine wax management, which means that they might need to see an ENT healthcare provider or a healthcare professional frequently to get their earwax cleaned out. These people might include individuals with exostosis or bony growth in their ear canals. This is really common here because it's common in surfers. But essentially, when we have extra growth in our ear canals, it can just make our ear canals smaller, narrow, which is the next group as well. When we have small or narrow ear canals, that means that there's less space for the earwax to accumulate, so you just might need to get it taken out more quickly. People with chronic skin conditions of their ear, such as psoriasis or eczema, this can cause dry skin, which also can become more easily irritated. And so some of the at-home methods of wax management are not ideal for these people. People with surgical ear changes, such as a mastoid bolt surgical ear or someone who has ear tubes can get clogged really easily. So these people would want to see an ENT healthcare provider to get the wax cleaned out more regularly. And people who have had other surgical changes, they just might be more at risk for infection. Again, people with chronic ear canal infections, these individuals also might want to see an ENT healthcare provider to get their wax taken out more frequently because they are possibly at risk of pain or other things associated with infections and earwax accumulation. And individuals who have a perforation or a hole in their eardrum also might want to see a provider more regularly because if you were to put drops or something in your ear at home, that could cause more damage or it might hurt. Some people who also might need routine wax management, but don't necessarily need to go to an ENT healthcare provider frequently, are people who are just aging. I guess that's all of us. And also people who use hearing aids, because hearing aids can sometimes stop the natural growth of, or the natural migration of earwax. All right, so a knowledge check for all of you out there. True or false? Earwax is typically a good thing. For many people, earwax naturally migrates out of the ear. This is hopefully an easy one. Perfect. We're coming in at almost 100%. Almost 100% of you said true, which is great. And yes, it is true. Most people, for most people, wax will naturally migrate out of their ears. So one term that I've used a couple times that I want to go over is the word impaction. So earwax impaction. Impaction is defined as the accumulation of earwax or cerumen in the ear canal. This can be caused if the self-cleaning mechanism doesn't work or if too much wax is produced too quickly. This can also be caused by people, unfortunately, trying to remove their wax, actually making their wax worse. So using Q-tips, cotton swabs, or something else that would push the wax further into your ear, it can cause it to build up and accumulate beyond the point of where it can naturally migrate out. People who have earwax impaction or accumulation might have different symptoms. Some people might experience worsened hearing loss, and that's because if the wax is completely blocking your ear, then you wouldn't hear as well. Some people might also experience pain or discomfort. They might experience itchiness. That's a really common symptom with earwax impaction. They also might feel like they have pressure in their ear, or it's full, or maybe they feel like there's water in their ear canal. And some people also might have ringing or buzzing in their ears or tinnitus. So you're experiencing some of these symptoms. What should you do? The first thing you should do before you try any at-home wax management solutions is make an appointment with a medical professional. Depending on your insurance or your preference, you might be able to make an appointment with your primary care provider first, and they can refer you to an ear, nose, and throat specialist, or you might just be able to go straight to an ear, nose, and throat specialist and come in and have your ears looked at. So another question for you, just to get a little background for us. Have you ever had your ears cleaned by a medical professional? You can say yes, no, or maybe you're not sure. All right, perfect. All right, so that's great. Most of you have had your ears cleaned by a medical professional. Maybe that's your primary care physician, or maybe you've come to an ENT office to have your ears cleaned. And of course, some of you said no, and some of you aren't sure. All right, so at our clinic, we use 3 main methods of removal. The first method of removal is using oils or drops. Certain oils or drops are able to loosen or break down the earwax. This can help oftentimes make manual removal or suction, the other 2 methods we use, easier. Manual removal is where a physician or a physician's assistant will use a tool, such as the one pictured here, to sort of scoop out the earwax. Suction is another method that we use here, which is performed with a microsuction device or a really tiny little vacuum, and it's under a binocular microscope where a physician or a physician's assistant is able to look into your ear and suck out the wax. Oftentimes at our clinic, a physician or a physician's assistant will use a combination of all of these different methods to get the wax out. So now probably a big question on all of your minds, what can you do at home? So remember, before we get into this, that a lot of you probably don't need to do anything at home. If you're suspecting that you have impacted earwax or a lot of earwax, you should come in and see a doctor, an audiologist, or a physician or physician's assistant, and they can advise you what to do. But for those of you who know that you have impacted wax or a lot of wax building up, there are some things you can do at home, and that typically includes over-the-counter drops. So we recommend Debrox or something like a mineral oil. You can also use hydrogen peroxide, but it's a little harsher. The benefits of using drops at home are that first, it can help loosen that wax that we talked about before. When it helps loosen the wax or helps break it down, this can also relieve some symptoms. So if the wax is blocking your ear, causing hearing loss or ringing or buzzing in your ears or pain, sometimes loosening the wax can relieve some of those symptoms. It can also then make the wax easier for a medical professional to remove. So if you're someone who needs to come in for routine wax management, the physician or physician's assistant might recommend that you start to use mineral oil drops, a week or so before you come in for your appointment. There's generally instructions on a lot of the boxes of or products you can buy at the store, such as Debrox comes with pretty detailed instructions. But just to go over it briefly here, how to use these drops are that you pull your earlobe up and back. You'll lean your head to the side, drop 5 drops into your ear canal with your head to the side or on a pillow. Then you'll massage the front part of your ear to help integrate the solution into your ear canal, and you'll let it soak for 10 to 15 minutes. After the 10 to 15 minutes is up, some kits come with a bulb syringe you can use to help gently loosen the wax more with water, or you can use warm soapy water over the sink or in the shower. It's important to be mindful that when you're putting water into your ear, to make sure that it's not too hot or too cold, because if it is too hot or too cold, that can actually cause dizziness, and that's not something you would definitely want to avoid. All right, and now this gets to what we should not do at home. And this is pretty simple. As a general rule of thumb, if it's smaller than your elbow, don't put it in your ear. This includes Q-tips, some gimmick or devices you might see advertised somewhere, such as this one pictured on the left, that might look like it twists the earwax out. It won't. It'll just push the wax further into your ear. There are also some older methods of wax removal that, maybe old wives' tales or myths that about removing wax, such as ear candling or other things. And we do not recommend trying those at home ever, because it's possible that it could cause more damage and be more dangerous for you than it would benefit you. So generally, just don't stick anything in your ears. If you have questions or if you're concerned about what's going on in your ears, come see somebody who's been medically trained to look in your ears and decide for you. A big thing that we hear often is that I use Q-tips because my ears itch. And surprisingly, Q-tips can oftentimes make your ears itch even more. It might be really tempting to stick a Q-tip in your ear to try to relieve that itchiness. But what that actually does is the Q-tips, which have little pieces of cotton on the end, the cotton can actually get stuck in your ear canal. And those little cotton fibers are really itchy. So it becomes a cycle of you have itchiness in your ears, trying to relieve it, so you use a Q-tip, but then that just makes it worse and contributes to the cycle. What you can do, if maybe you identify with this, is you can stop using Q-tips. And if after a few days your ears still really itch, you can schedule an appointment to come in with a medical professional. They might prescribe topical ointment or drops to help relieve that itchiness. All right, so a quick knowledge check. Hopefully this one's pretty easy for you guys as well. Which of the following are risks of Q-tip use? Puncturing your eardrum or accidentally poking a hole in your eardrum, impacting earwax or causing an accumulation of earwax, or making your ears itchy, or of course, all of the above. All right, perfect. So it does look like most of you said all of the above. Of course, impacting earwax and possibly hurting your eardrum and making your ears more itchy are all risks. Good job. All right, so the general takeaways for this presentation are that first, earwax is a good thing. It protects your ears and it can provide comfort. It can provide comfort for your ear, protecting it from dirt and dust, dryness, that kind of thing. Some people might have earwax impaction naturally, but a lot of people can prevent earwax impaction by avoiding Q-tips or anything that could push the wax deeper into your ear canal. Remember that earwax will generally work its way out of your ear naturally. It'll migrate out when you move your jaw, and just naturally that's what happens. If you suspect you have a lot of earwax, or if your earwax is impacted, see an ENT healthcare provider, someone who is medically trained to look in your ears. If they recommend to you that you can do so at home, you can use mineral oil or drops to help loosen that earwax over time, and that can help relieve some symptoms and just be more comfortable for you. Do not try any other at-home gimmicks or trying to use Q-tips to take the wax out, because it'll just push it deeper into your ear and make everything a little bit worse. So a final poll question for you. Your opinion, was this information helpful for you or not helpful? You can rate on this scale wherever you feel you align. All right, great. Thank you so much for answering. We really appreciate that. Any feedback you have will help us critique this and make it better, more informative for you in the future. A few resources I want to point you in the direction of include our website, eardoctor.org. We have a lot of different pages on there that if you have any questions or any curiosities about who we are, the different kind of appointments we see, the different kind of things we do here, that website is full of information. If you are curious about what's going on in your own ears, you can also schedule an appointment. You can call the number listed here to schedule an appointment to see an audiologist or an ENT healthcare provider. And you can also request an appointment on our website. We also have social media platforms for you to follow us on. We'll be posting extra content for you and information. And you can follow us on Instagram, Facebook, or Twitter at the handles listed here. All right, and now we will open it up to questions and of course, leave that information for you here. Yeah, so it looks like we had one question and Carolyn's going to join us for this part. So the first question that we received ahead of time, for those of you who took the time ahead of time to reach out with questions, thank you so much. So the first question is, I never use Q-tips. I never use a Q-tip in my ear, but I was wondering, would it be safe to use a Q-tip up to the canal opening, but not into it for water after washing my hair? This is a really common question. I'm sure Carolyn would agree. I get asked this all the time. Carolyn, I'm curious your answer. What would you say to that?
I would say the better option would be to use like a washcloth or a towel over your finger and then just kind of gently dry the ear canal like this. The other option, and another few questions also kind of align with how to dry your ears without a Q-tip. Another safe and other manner would be to use a low setting on a hair dryer. Again, nothing too hot or too cold because that could cause dizziness or pain. But again, just kind of low setting with the hair dryer toward the ear canal is also a safe way to dry the ear. In terms of the Q-tip, I really would advise against just not using it at all. Even though I know you're only going on the outside, the reality is there is injury risk that could occur if your elbow moved too fast. We've had patients get bumped. And again, it's not the optimal way. So I would recommend a finger with a washcloth or a low setting on a hair dryer.
Great, thank you. We also have received some other questions from people who maybe have some more personal medical questions. And so we definitely appreciate you reaching out and asking those personal medical questions, but we will advise that if you have maybe a more complicated medical history with drainage or ear dryness or something like that, if you're not sure, we definitely recommend scheduling an appointment to come in to get your questions answered in person, where a medical provider can take a look in your ears and talk to you about some solutions for perhaps drainage or your ears not drying enough, that kind of thing. All right, the next question we have is, do the use of earplugs push earwax or push the earwax in or cause earwax impaction? That's a great question. What do you think?
Yeah, it definitely can. We have patients who may sleep with someone who snores, or they want to use earplugs to sleep. And that is oftentimes a reason for impaction. Definitely the kind that, compress and then expand in the ear canal. So they kind of fit in that first half to third of the ear canal are definitely known to push the earwax in. So if you are known to sleep with earplugs every night, you may have more wax problems as a result and may want to have your partner screened regarding their snoring if that's why you're wearing them. The earplugs that fit primarily on the outside of the ear canal and may not, push as far in would probably be the better choice depending on why you're wearing them. Of course, that also would factor in the choice. But yes, wearing earplugs chronically, or now when people are on Zoom all the time or wearing earbuds more frequently, this can also contribute to the ear migration not being able to occur. So it's definitely good to, take breaks if you wear earplugs, and again, not sleep with earplugs every night.
Great, thank you. Okay, the next question we have is for someone who gets their hair cut frequently, and they're worried about tiny hairs possibly getting into their ears after haircuts. What do you have to say about that, Carolyn?
Yeah, I definitely find a lot of hair in people's ears, and it can cause itching. That's another common reason people itch, or even may hear tinnitus or kind of a scratchy sound in their ear if there is hair on the eardrum. It happens. So you can wear an earplug if you're concerned when you get your hair cut to prevent that. At the same time, if the hair's in there and you don't have any symptoms, meaning you're not feeling an itch sensation or hearing a tinnitus or scratchy sound, then most likely it's not going to do any harm, the hair getting in. But if it's giving you a symptom, again, of, itching or tinnitus sound, then yeah, I would advise an earplug or covering your ear on that side when you get your hair cut, and if it's persisting, being seen by a healthcare provider so we can take the hair out and make sure it's gone. Sometimes really hard to see, and it's almost impossible for someone to see on their own.
That's a great question. Another question that we were asked was, are there any warm water devices to wash out the ear canal? Are those okay to use? What do you think about that one?
In general, I wouldn't use any ear washing device unless you have symptoms primarily. If your ears feel fine, they hear fine, they don't feel plugged up, it's better just to let them be. If you know there's wax in there, or someone looks and says, oh my gosh, it's full of wax, then I would say it's probably better to first start with softening the wax, like Nina described with the debrox. Water itself typically is not going to get wax out. It needs to be softened to make it more of a soft solution. And then after you softened it, then you can attempt, like, again, the warm water bulb syringe that comes with the debrox kit, or possibly in the shower. But again, definitely soften it first, as was described, before you attempt to do just water alone.
All right, the next question we have.
Okay. I think there's a question about a black head in the flat part of the ear, and we can actually, so I think what is being described is kind of right in the ear opening, in the what we call the conchal bowl, and even sometimes around the opening. We have sebaceous glands, sweat glands, that can get clogged and cause almost like zits in our ears, or in the opening around our ears, and sometimes that material can oxidize and turn black and look like a blackhead. This is definitely something that can sometimes be just removed in the office or expressed. Obviously, wax doesn't really have anything to do with this directly, so this would be something I would recommend if it's causing pain or you're unsure, to follow up with your healthcare provider.
Good questions coming in, and I see we have more and more coming in, so thank you so much for people who are submitting questions. All right, the next one is for hearing aid users. A great question. How often should I use debrox as a hearing aid user? That is an excellent question. My instinct is, of course, it depends on the person, and it depends on how much wax you make. Remember, everybody makes a different amount of wax at different rates. And so it would just depend. If you're not sure about how much wax you're making, or if it's affecting your hearing aid use, you should definitely come in and see an audiologist or a healthcare provider to talk about that. Do you have anything else to add for that one?
Yeah, I think being a hearing aid user, especially if you're new, it's hard to know if your hearing aids are functioning sometimes optimally. So it's really important to check regularly with your audiologist to make sure they're functioning well. And then they, at that time, oftentimes obviously will look in your ear and see if there's a significant amount of wax. So if you're having feedback issues, that would be another sign there may be wax. But just as a general recommendation, I would say if you're new to wearing hearing aids, it might be good to get your ears checked a couple times a year, maybe every 6 months, and just see how much you're building up, so that you're not wasting those precious batteries and, hearing aids and not hearing optimally. We have a lot of patients that do need to be seen routinely, anywhere from every month at the most frequent to maybe, once a year. So it might be good just to get a baseline as to how much you're building up. And then from there, we can stay on top of these problems and hearing, any sort of hearing loss that's not undue to wax. So we can get you on a proper schedule.
Great. Okay, the next one.
All right. Okay, go ahead.
It says, are alcohol with vinegar drops okay to use in the ear to break down wax? This individual uses this solution to help avoid ocean water infection and or breaking surface tension of water trapped in your ear where you have surfer's ear or the exostosis, those bony growths.
This primarily isn't going to break down the wax. To let you know, the alcohol and the vinegar drops, it won't soften the wax. It may slightly, but not effectively. the primary reason to do that, the alcohol / vinegar, kind of a 50-50 solution after water exposure, is to help dry the ears to prevent infection. So after you expose to water, especially ocean water, which is a little dirtier than, let's say, pool water, yes, it's definitely a reasonable thing to do, to use the kind of alcohol / vinegar solutions or over-the-counter swim ear. I wouldn't do it on a regular basis, though. It can be overly drying to the ear. So if you're doing it, all the time, every day or multiple times a day, that can cause some over dryness. But again, like if you're surfing a couple times a week or on a vacation or want to prevent infection, yes, those are safe to use for primarily infection prevention and dryness, but likely isn't going to have a huge impact on wax.
Great questions. The next one says, this person has difficulty with wind in their ears. So they put a cotton ball or a piece of cotton into their ear to help keep the wind out. Is this okay? What do you think about that one?
It's probably not going to push much wax in, but like I said, if you're doing that a lot, it could trap moisture and increase your risk of infection, or again, mitigate against the migration of wax if you're doing it like, hours a day or for long periods of time. If the wind bothers your ear, I would be more interested in knowing, maybe figuring out why that's happening. There may be some underlying hearing loss or sensitivity to sound, because that definitely is something that could be an underlying medical issue, the need that you need to do that. But like I said, as a general problem, as a general rule, putting a cotton ball in your ear occasionally is not going to do any long-term harm.
Great. We also were asked to repeat the answer on how to remove water from your ear, maybe after you're swimming or after a shower or something like that. So if you wouldn't mind repeating that answer, that'd be great.
That's a common question, because people feel that kind of snaky feeling in their ear when water gets in there. And let me just first back up to say, I don't flush water in your ear purposely in your ear when you shower. Some people do think they need to get water in there. So number one, don't purposely put it in there unless, again, you're doing it for a one-time wax removal. Again, what I would recommend is the two best options for just routine drying is a washcloth on your finger and then just gently drying. If you still feel like there's water in there, a low setting on a hair dryer directed toward the ear canal, meaning not too hot, a lower temperature setting. And then if it's still a persistent problem, it could also mean there is wax in your ear and it's actually trapping the water behind it. So if it's still happening on a routine basis, you might need to get your ears looked at, and let's make sure there's nothing in there that's causing the water to stay trapped.
Great. Another question that I personally receive all the time, I'm sure you receive this one too, is what do you do for flaky skin around the opening of your ear?
Yeah, that is common. And oftentimes, sometimes there's some history of eczema or psoriasis. And for some people, it's only in their ears. So they may not even know they have it other than in their ears. If it's just on the opening, a generally safe thing to first try would be to, number one, stop Q-tips, because that will make it worse. If you're using hydrogen peroxide, that will make it more dry and more irritated, or rubbing alcohol, that will make it worse. So make sure, number one, we're not making it worse. The second thing you could try is a 1% hydrocortisone cream, which is sold over the counter, and just a pea-sized amount, again, with your finger and just at the opening. You don't want to push it in. But that is something you could use for about a week or two at bedtime, like once a day. And if the flaking and itching is still there, then you may require a more potent or prescription dose or evaluation further.
Great. And it looks like we have one more question. All right. And if this person is asking, when you do use debrox or mineral oil to soften the wax, how many days in a row should you do it? Another great question.
Yeah, I'd say, there's more than one way to do this. The general recommendation is to try it first. Just put the softening debrox in, let it sit for 10 to 15 minutes. Oftentimes there may be some bubbling or some other sounds. Flush it out after that with some warm water or in the shower. If that failed, meaning you still feel like they're really plugged up and the wax maybe wasn't fully removed, you could use the Debrox every day for maybe about 5 to 7 days, just the drops alone, and just let it drain out, and then reattempt the flushing with the water or bulb syringe. I would say if you try it more than twice at home and something's still not right, you should probably be seen. But like I said, I would try it first once, and then typically about 5 to 7 days of Debrox to soften, and then attempt again would be a good thing to try, assuming there's no pain or drainage or a huge hearing loss.
Great. Thank you so much for everybody who has asked questions so far. We are definitely going to stay around for a little bit longer, so you can ask some more questions. Oh, we just got another one. Can you use a neti pot water?
Can neti pot make water wax worse?
Okay, can using a neti pot make your wax situation worse? Great question. What do you think?
I'm assuming the neti pot most people uses in the nose to help with nasal irrigation. So they're not usually putting it in the ear. I may have some misunderstanding of the question, but I think the question is using the neti pot in the nose going to make your ears worse? And that would typically no, although sometimes the neti pot, when you're putting drainage or water in your nose, in theory, you could cause some inflammation to the eustachian tube. And maybe cause some hearing plugging temporarily after using that. So, but the neti pot in the nose would have no effect on the earwax. I may have misunderstood that.
If you ask that question, feel free to clarify it again when you submit it, and we can go further if that's not what you meant. And we're also still happy to wait for a few more minutes if people have any other questions that are rolling through. I do see that some people are leaving us. So if you are, thank you so much for joining. We really appreciate it. If you maybe weren't able to join right away at 11, please remember that this whole talk has been recorded and will be posted as well. So if you have any questions, or if you want to go back to reference something, you can definitely watch the recorded version at a later time. Or if you feel as though this information would be helpful for someone else, please feel free to share it with anybody else. And we're happy to stay on a little bit longer if anybody has any questions. Someone just asked, where would we find the recording? And that is a great question. It'll be available on our website as well as on our social media platforms. So on these, you can follow us, like I mentioned before, on Instagram, Facebook, or Twitter. And we have our names or our handles listed here with the @ symbols. So if you're on Instagram, Facebook, or Twitter, you can definitely find this content there. There will also be other content posted as well, just information and possibly some videos and stuff like that as well. Thank you so much for joining us. We really appreciate everybody's interest and, of course, all of your questions. So thank you so much.
Thank you.
Yeah, we'll stay just a little bit longer just in case anything else rolls through. All right, perfect. I think that's it. And we're seeing more people leave. So if you stuck around, thank you again so much. Have a great rest of your day.